So, we didn't have experience with anything like this. And, we have tornadoes. That's a different kind of trauma. So it was a learning experience. So many people just stepped in to help out. So many of our psychiatrists just spent hours helping out.
Survivors of the Oklahoma City bombing say when they walked out of the Murrah building 30 years ago, nothing was the same.
It was a whirlwind. One term I use is sensory overload.
Since that moment, they've been working on their mental health, and they've had doctors and therapists alongside every step of the way.
They did studies, and that's one outcome of the bombing that was positive is they said people connected with OU and other places, and I participated in that not because it was easy, and it wasn't therapeutic. It was just designed to say, well, how are you doing after X number of months or whatever.
Those doctors reached out to survivors, asking all kinds of questions.
Our nurses are so gentle that they did everything they could to not traumatize people, but the patients talked about what they had been through, and then there was a trauma script made, and then for 2 minutes before, during, and after the script, they measured blood pressure and heart rate responses.
Some of the resulting surveys showed the impact of moving away from Oklahoma and how that impacted survivors. Other results were used to determine what kinds of services were still needed years later.
But we looked at things like PTSD, depression, medical problems. If biological stress measures are elevated in healthy people, you'd think they'd be elevated in everybody. Are they unhealthy now?
But the pros at OU didn't just survey the survivors and ask them how they were doing. They drew blood. They measured physical markers against people who were never impacted by the bombing. The responses of the survivors showed resilience, but their bodies did have some after effects.
So that kind of told us that the body still remembered. So the biological stress measures were increased in this healthy group, but their PTSD and depressive symptoms were not that elevated. So it's as if the body held on to the memory, whereas the mind was kind of letting it go.
But they also found in some of the studies that big health problems mostly stayed away.
So what we found was there was actually no difference in major medical problems like cardiovascular, cancer, etc.
And the researchers say this was a start and helped prove that time does heal some wounds.
I think it very much helped because I think we realized that some things do get better over time.
Colby Terrell, KOCO 5 News.